Hi, everybody. It's Rose. I'm here with Nicole, Jordan, and Hannah, and we're going to talk to you about the nutritional aspect of atherosclerosis. I hope everybody's safe and not sick at home right now. So just to start off, just reviewing atherosclerosis, it's a disease in which plaque builds up in the arteries. The main part that we're going to focus on is how the components of atherosclerosis are multiple different things, but we focus mostly on the cholesterol aspect. And also, Hannah mentioned that the effects that atherosclerosis has is built up over time. So it's a biological happening that all of us are going to get plaque buildup in our arteries, but a matter of what you eat is going to either progress that or prevent it from happening. So I'm going to send it over to Nicole to talk about the LDL pathway.
Okay, so focusing on cholesterol, the LDL pathway is very involved. Most cholesterol is transported into the blood as cholesterol esters, which is in the form of lipid protein particles, which is known as LDL or low density lipoproteins. So when a cell is going to need cholesterol for the membrane synthesis, it's going to make this transmembrane receptor protein, which is for the LDL, known as LDL receptors. And these are going to diffuse until they associate with the clathrin-coated pits that are in the process of forming on the sides. And once this is attached, the coated vesicles are going to form as they close around the LDL. And any LDL particles that are bound to the receptor is going to be taken into the cytosol in these vesicles. And then once the shedding is of the coats come off, the vesicles are going to deliver the contents of the LDL and the LDL receptors into an endosome. Once it's in the endosome and it's in the pH zone, they're going to break apart. And your LDL receptors are going to return back to the surface to then take in more LDL. And the LDL protein that is actually in the endosome is going to be broken down. And then these are going to be hydrolyzed into free cholesterol, which is now available for the cell to use for energy. And 1 in 500 individuals will inherit a defective LDL receptor gene. And this will cause LDLs to not attach to the LDL receptor. And when this doesn't happen, it can accumulate in the zone, which can increase your risk for atherosclerosis. So moving on, we're going to be looking into specifically how LDL and having that damaged receptor can cause atherosclerosis. So I know this is a very busy picture, but I'm going to be focusing more on specifically the LDL, and then later on Rose will talk more about the inflammation aspect of it. So a fatty streak phase is basically the initiation of atherosclerosis, and this is the dysfunction of the endothelial cells from arterial injury. And arterial injury is more likely to happen at the curves in the arteries or in branches because they're more subjected to low shear stress and disrupted blood flow. So these prone areas will have reduced endothelial nitric oxide synthase, also known as eNOS, and they'll also have superoxide dismutase, or SOD. And these usually lead to a compromised endothelial barrier integrity. And because we already have damaged LDL receptors and we already have the accumulation of LDLs, these are also known as ApoB, which is the main structure of LDLs. And these will carry them into the subendothelial space. Your retained LDLs, which are your LDLs, your VLDLs, which is also involved, and then your ApoE remnants. They're going to be modified by usually oxidation, and then these will form into the modified LDLs. And then along with some other factors, this will also promote the activation of endothelial cells onto the barrier, making it more prone and promotes that inflammatory response. And so just looking a little bit later on past that initial inflammatory response, your macrophages are going to express receptors that will mediate the internalized VLDL, APO remnants, and the modified LDL. And these are going to form foam cells. And so with more inflammation, there's going to be more LDL oxidation, more endothelial cell activation, and this is just going to make even more foam cell formation, which is just going to continue the cycle.
Okay, so sorry, I went the wrong way with the pictures. So going off of what Nicole talked about, I am going to still be referencing this picture, but I'm going to go this way. So I'm going to talk more about the inflammatory pathway. So like Nicole said, atherosclerosis happens due to elevated LDLs and when you have an endothelial dysfunction. So apolipoprotein B, or ApoB, like Nicole mentioned, is a structural component of the LDLs, and that has been seen to increase the activation of the endothelial cells and promote atherosclerosis. So when you have elevated LDLs, you're going to increase this ApoB, and which in turn increases the activated endothelial cells, which increases the inflammatory response. So it's just a chain reaction. So when you activate the endothelial cells, you're going to have leukocyte adhesion cells, which bind to ligands on the endothelial cells. And then you also have chemokines, which are going to attract white blood cells. And both of those are going to recruit the monocytes and the T cells to the endothelial site, sorry. So the T cells are going to respond to the lesion by secreting a pro-inflammatory cytokine, and then this is going to lead to more inflammation and plaque growth. But the monocytes are more important. They're going to differentiate into both macrophages and two different types of recognition receptors. Those are called the scavenger receptors and the toll-like receptors. So the toll-like receptors, or the TLRs, those are going to signal to release different cytokines, proteases, and vasoactive molecules. Whereas the scavenger receptors are really the main part of all of this, and they're going to cause the formation of the foam cells. So if we go back to the previous slide, the foam cells are right here, and pretty much everything that I just said is in this picture. So you have the macrophage here, which it's not specified in this picture, but this is where the scavenger cell is, and they're going to take all of the modified LDLs that are around here and put them together and form the foam cell. So after this happens, you're going to have what's called a fatty streak, and a fatty streak is just a bunch of those foam cells clustered together, and then that's what's going to lead to the blockage. This doesn't happen all of the time. Just because you have some of these foam cells does not mean that there's always going to be a clinical implication, and you can actually start regressing with this, but most of the time, once you have the fatty streak, it can also have, I have another picture. So you'll have your smooth cells down here. And if they break this layer here called the tunica media, they can actually enclose the fatty streak, and this is a much worse prognosis for you. So now I'm going to send it over to Jordan.
So the medication that people usually have when they have atherosclerosis is statins, which those lower the LDL cholesterol and they stabilize the lining of your heart's arteries. They also have antiplatelet medication, which then reduces the chance of platelets clumping and causing a blockage in your arteries. They sometimes use beta blockers, which just lower your heart rate and blood pressure, and diuretics, which just lower your blood pressure, just like a water pill. And then they also use ACE inhibitors, which that just helps slow the progression by lowering your blood pressure, help slow the progression of atherosclerosis by lowering your blood pressure. And then calcium channel blockers, which also lowers your blood pressure, and that can be used to treat chest pain, which is angina. So some benefits with the nutritional modifications are if you have a better diet, then you can lower your blood pressure, lower your cholesterol levels, and decrease the inflammatory response. And the issues that you can have with an uncontrolled diet is pain with walking, confusion, numbness, weakness in the face, arms, or legs, dizziness, chest pain, slurred speech, difficulty speaking, temporary loss of vision. If you have temporary loss of vision, slurred speech, dizziness, numbness, weakness in the face, arms, and legs, that can lead to a transient ischemic attack, which can then lead to a stroke.
So I'm going to be talking about the specific nutrition in regards to like what foods might decrease the impact of atherosclerosis. But to figure that out, we kind of had to figure out what was causing the problem. And we know that atherosclerosis is represented by a state of heightened oxidation in the vascular walls of arteries. But according to the research, it remains to be established if the oxidative stress it's like a chicken and the egg thing, like what came first. So it's all tied together, the oxidation and the inflammation. So the diet that was recommended is a anti-inflammatory and antioxidant rich diet, which we talk about on the next slide. So again, we are trying to focus on anti-inflammatory foods and antioxidants. So a couple of the ones that we're going to talk about specifically is vitamin C, vitamin E, and polyphenols. I think that's a typo. And so vitamin C has been shown to prevent apoptosis of the epithelial cells or endothelial cells, which is caused by the cytokines, which are released by the immune cells in response to the cellular damage that is caused by the free radical damage. Vitamin E is another antioxidant that we're going to talk about, and that has a fundamental role in protecting the cells so that they can prevent further damage, which is caused by the oxidative stress. Basically, just gives them a coating of protection. And then the polyphenols are reducing agents. So reducing agents reduce oxidizing agents. So in turn reduces the damage caused by free radicals. Excuse me. So specific foods that would be good to decrease the impact of atherosclerosis are green and yellow vegetables because they're high in those antioxidants like vitamin C and E and polyphenols. That's the correct typing. And they're also rich in carotenoids. And there was a meta-analysis of 11 cohort studies that showed that the consumption of carotenoids and vitamin C and E have been shown to inversely be associated with cardiovascular accidents and disease, which includes atherosclerosis. The recommended intake was a minimum of 3 servings a day, but the study showed that with increasing servings, your risk would also decrease. And then a couple of examples of vegetables that would be good and be rich in those vitamin C and E antioxidants is spinach, kale, and collard. So your dark green vegetables, and then summer squash, pumpkin, and carrots. So those orange and yellowy vegetables. So another obvious one, fruits are good for your health. Berries and citrus fruits specifically are high in those antioxidants. Anthocyanins are also another type of antioxidants. So these are going to reduce inflammation and boost your immunity. And the recommended intake was at least 3 servings per day. All of the berries, like strawberries, blueberries, blackberries, and then citrus fruits like grapefruit, mango, and papaya. Mango and papaya, and grapefruit too, actually, will also have a lot of those carotenoids that were talked about on the last slide. And then fish. So when I was doing my research, a lot about the Mediterranean diet or the anti-inflammatory diet came up for atherosclerosis. And so I was not surprised to see fish on there as well, because fish, especially mackerel, herring, tuna, and salmon, are high in those polyunsaturated fats. And specifically, the fish that are high in N3 polyunsaturated fats have shown to have reduced platelet aggregation, triglyceride and anti-inflammatory effects, and plaque stabilization. So obviously, when you decrease the amount of saturated fat you have in your diet and replace it with healthier fat, it's going to be good for your health. But specifically, these types of fish at the bottom are good for the reasons stated above that will help atherosclerosis. And then it said that consumption of fish at least 2 times a week was good, but it also said that consideration of supplements would be beneficial.
Okay, so in summary, for the pathways, atherosclerosis is an inflammatory disease, and it's going to increase the inflammatory response, which at the end can cause either thrombosis or a plaque rupture if you don't either take the medications or change your diet. Specifically, the LDL pathway is closely linked to the start of an inflammatory response, and then atherosclerosis with the mutation of the LDL receptor causing the LDL buildup. Foam cells are what form the fatty streak. And for the medications, statins and antiplatelets are the ones that are used most often and most common for medications. And for diet, you want to try to incorporate foods that have a lot of anti-inflammatory and antioxidant properties to help slow the rate of atherosclerosis. And that is all. Our sources are here. Nicole also put her part on a transcription after the sources, just because it was a lot of things going on at once. So you don't have to take hardcore notes on those, trying to listen to her talk about all of them. But thanks, guys.